Hello, everyone. This is Siddharth Amber from Chicago Arthritis and Regenerative Medicine. Welcome to our weekly Monday educational broadcast. So at Chicago Arthritis and Regenerative Medicine, we specialize in the evaluation and treatment of arthritis, tendonitis, injuries, and back pain, utilizing the most up-to-date treatment modalities that are available. And this broadcast is really meant to go over frequently asked questions that patients, my own staff, usually have, and a forum for me to kind of discuss them and go over principles that I think are relevant and interesting as they answer what are people's kind of pressing issues and questions regarding their musculoskeletal health. So normally we do this a little bit earlier in the day, either at 9 in the morning or at noon. We're doing this a little bit later today, toward the end of the workday, just because of the nature of the rhythm of the workday. I'm sure, as some of you have noticed, I know I certainly have, life seems to be moving a bit faster, and sometimes the day kind of catches up to you, and you just need to catch up on some of these important things, even toward the end of the day. I am certainly committed to doing these sort of educational broadcasts, and so happy to do this toward the end of the day. So, topic that I am chronically interested in and that I think is going to get even more interesting in the world that we live in is the concept of inflammation, specifically in my own practice when it comes to musculoskeletal conditions, arthritis, tendonitis, those sorts of things. And I'm going to touch on a few different aspects to how this is relevant: tendonitis, inflammatory arthritis, and even post-COVID kind of issues, a developing kind of problem that we're going to be hearing more and more about. So inflammation, it is the body's normal process of reacting to any kind of abnormal stimulus or signal. Can't really think of it as all inflammation is bad, because a lot of inflammation has a appropriate purpose. You need to understand the why it's occurring to get a better handle as to what to make of it and how to treat it. So in general, inflammation is where you get an influx of cells, cytokines, growth factors that are meant to modulate tissue that has been affected in some way. And inflammation is meant to create a change to a response to a signal that the body is recognizing. Clinically, what you'll notice is redness, swelling, warmth, and pain frequently as well. Again, it's important to recognize that inflammation is not just a bad thing, that it does frequently have a purpose. And it's always not a good thing either. Again, sometimes inflammation can be out of control or chronic, and that can be a problem. But it is the body's normal response to some kind of stimulus. So depending on the stimulus, the types of cells that come out as a reaction will be different. So as an example, if you have inflammation due to an acute injury, that is going to lead to a certain type of cell line and a certain type of inflammation that occurs, as opposed to, let's say, someone that has chronic instability in the joint that leads to chronic inflammation, which has a different type of inflammatory response. And then, of course, if you have inflammation as a response to an external stimuli, let's say an infection or some kind of other kind of external element that the body's having an allergic reaction to, it instigates a different type of cellular response. And of course, then there's also chronic inflammation that occurs if you have, let's say, a systemic autoimmune condition where your body is miscommunicating, the immune system is miscommunicating, recognizing your own body is foreign, and then creating an inflammatory response. Or if you have, let's say, chronic metabolic syndrome, where due to a altered endocrine hormonal response or signal, that the immune system then has a chronic inflammatory response to that. So important to recognize that inflammation at an acute level can have some benefit. Let's say after an acute injury, that sort of inflammation is good, or an acute response to some kind of external stimuli, let's say an infection, can be a good thing. But if it's overly aggressive, that can be a problem. In general, an acute inflammatory response, you want to let that play out unless it's too severe. And so certain options that are traditionally used, things like ice, anti-inflammatory meds, steroids, in an acute inflammation response can be problematic because you're really short-circuiting the body's normal way of trying to recover. Chronic inflammation, on the other hand, is a problem. If you have chronic inflammation due to, let's say, instability, that is the body's inappropriate or incorrect way of reacting to something. Or chronic inflammation because of a miscommunication in the immune system causing that kind of inflammation, that's a problem. And these are problematic types of inflammation, and they should be appropriately addressed and treated at the root cause. And as much as you can treat it at the root cause, you give yourself a better chance of trying to actually solve that kind of chronic inflammation. So inflammation in musculoskeletal conditions is something that I see a lot of as a clinical rheumatologist. And so obviously it's something I'm interested in. So I'm going to talk about 3 different ways where I see inflammation and how you can think about this. So tendinitis is a really great one. Tendinitis really means inflammation in a tendon, but the reality is that what we call tendinitis is not always the same thing. So one of the great aspects of musculoskeletal ultrasound is that you can look at tendons in a really detailed and nuanced way. You can find small tears that you might not find even on MRI. You can find subtle signs of instability or weakness in a tendon with dynamic scanning, where you have somebody move their body through a range of motion, and you can detect other types of injuries. It's an incredible modality. It literally gives the practitioner almost like 3-dimensional vision, right? Or X-ray vision almost. And to really look at a tendon in that way is very neat. And it's also important to understand that certain types of tendon injuries, you can differentiate between what is really severely active inflammation versus a tendon that is just chronically degenerative or worn out. So a tendon that has some chronic changes that indicates chronic stress on the tendon, that would be called tendinopathy. That really just means that there's some pathologic findings in the tendon that indicate that the tendon has been chronically worn. That can then progress into more and severe degrees of tendon tears. That's different than, let's say, tendon inflammation or tenosynovitis. Tenosynovitis is a finding on imaging, let's say ultrasound or MRI, that shows more definitive inflammation, where you see neovascularity or blood vessel formation within a tendon when it wouldn't normally be there. It's a sign that the body is bringing in more cells and more mechanical changes and posture, work-related things, or if that tendon lets bone marrow-derived stem cells to actually treat that chronic tendon injury. Tenosynovitis, on the other hand, should make you think of a couple different things. Number one thing I want to know is there inflammation anywhere else? Is it whether they have chronic diabetes or metabolic syndrome that makes them more prone to inflammation, or they are psoriatic arthritis picture that's causing inflammation in the tendon. Inflammation is something else systemic or bigger going on. If you've ruled that out and you don't see anything else that indicates that, then you need to start thinking, is there that much stress on this tendon that it needs to be treated a bit differently? So that difference in treatment is as such. If I see an inflamed tendon, I think a better treatment as a first-line treatment would be to utilize if an injectable treatment would be to utilize an anti-inflammatory injection, such as alpha-2 macroglobulin, rather than a steroid, which is unhealthy for the tendon. But use that rather than just straight platelet-rich plasma, because platelets are more inflammatory. And alpha-2 macroglobulin is going to be more of an anti-inflammatory. And that's a better first-line option if you're treating that chronically inflamed tendon. On the other hand, if there isn't that significant inflammation, as a first-line option, platelet-rich plasma is a good first-line option for a lot of sorts of tendinopathies. And if that tendinopathy is more significant, or it's a more significant tear, then utilizing your own bone marrow-derived stem cells makes sense as well. So that's a case where inflammation makes a difference in terms of what's the pathology, what else you should be thinking about, as well as what sort of treatments you would utilize. The next one is inflammatory arthritis. So this is where someone actually has significant inflammation in the joints. So a lot of times when people have pain, regardless of the cause, whether it's wear and tear arthritis, degenerative arthritis, or it's inflammatory arthritis like rheumatoid arthritis, they'll describe their symptoms as feeling really inflamed and sometimes swollen, but definitely inflamed. That's generally how arthritis is described. But the reality is there's a big difference between wear and tear arthritis and really severely inflamed joints, such as inflammatory arthritis like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis. Now, you can tell the difference in a couple different ways. Number one is on examination. A joint that is significantly swollen is generally more inflamed than a joint that is not swollen. Now, in something like rheumatoid arthritis, the inflammation is so severe, you'll find that inflammation even when you check somebody's blood, that there's that much level of inflammation. It's not just in the joint, it's in their entire body. But the other thing that you'll find on, let's say, ultrasound or MRI are some subtle findings of inflammation that you will not find in someone that has wear and tear arthritis. On the other hand, someone that has such bad wear and tear arthritis that they do have fluid in the joint, they may not have the same level of inflammation that, let's say, someone with rheumatoid arthritis has, but they may have a very mild degree of inflammation in the joint. And you can tell the difference because when you actually take fluid out of the joint in a rheumatoid arthritis patient or psoriatic arthritis patient, that level of inflammation is just through the roof, meaning you'll check the number of cells, inflammatory cells, and that will be just absolutely through the roof. In a wear and tear arthritis patient, classically, that'll be at a normal level. Or if there is some chronic fluid in there, chronic inflammation, very mild inflammation, you'll see a mild degree of inflammation when you actually check that in the lab. Big difference, because if somebody has severely active inflammation throughout the body, you need to treat that at the source, what's driving that, and not just look at it as, hey, there's inflammation in the joint. If you look at it as only there's some inflammation in the joint, you're missing the bigger picture. And you need to treat that bigger picture in order to actually treat what's driving the inflammation in the joint. On the other hand, if what they have is more of a wear and tear arthritis picture, then treating at that joint and the surrounding tissue is the right way to go, rather than giving somebody chronic pain medications, chronic anti-inflammatory medications, where you're really not treating the root cause of their problem, you're just treating their pain response, which is not the same thing. The last one that I want to discuss is post-COVID symptoms. This is starting to become an issue as we have more and more people who are getting infected with COVID-19 and more of those people as they quote unquote recover and some of the chronic symptoms that they have. So, we know that if you've had a infection, let's say a viral infection, whatever type of viral infection, that having some chronic discomfort, aches and pains, a little bit of fatigue for a few weeks, few months, that can happen. That's actually a relatively normal response after an infectious response. This COVID-19 is a little bit more than that, though. And a study came out recently, I think a couple of weeks ago, from Germany, and they looked at 100 people that had COVID-19, and they checked in with them basically 2.5 to 3 months later to see what was going on from their symptoms and what was going on from a cardiac standpoint. And what they found was that 78% of the people had some objective evidence of cardiac involvement that was still present. I'll talk about that in a second. And 60% of those people actually had evidence of inflammation in the heart on cardiac MRI. And that was regardless of the degree of their severity of their original infection, whether they had mild, moderate, or severe, it didn't matter, that these people still had that chronic inflammation months later. That's concerning, right? It's a sign that the body has had a response and that it's continuing to have a chronic inflammatory response, and that is a problem. This will come up in my practice because people will show up with chronic pains in a joint or a tendon, and it's a matter of figuring out at that point, do they have severe chronic inflammation in a joint that may need to be treated? Or do they have some other cause for pain? Let's say a chronically unstable joint that due to some relative inactivity after their infection has gotten worse, in which case you need to treat that as a chronic unstable joint or degenerative joint. you don't need to think of that as a chronically inflamed joint. But objectively, if you can find that they have chronic inflammation in the joint, whether that's on labs, whether that's on imaging such as ultrasound or MRI, or by taking fluid out of a joint, or even sometimes examination findings, then you have to treat that differently. Then you need to look at that as someone who's developed some chronic inflammation in the joint, and that may require treatment. Whether that is medication that's meant to be a chronic anti-inflammatory because their total body is inflamed, or if that one joint is still inflamed, treating that one joint in an isolated fashion with a cell-based treatment that has more of an anti-inflammatory effect may be beneficial as well. We're just at the tip of this, and we're not exactly sure how that's going to play out with COVID-19, but combination of some early things that I'm seeing amongst patients, what I'm hearing, and that small but early study from Germany definitely has me concerned that inflammation in folks who have COVID-19 may be something that we hear more about in the next couple of months. But inflammation, always on my mind as a clinical rheumatologist and as someone who sees a lot of chronic arthritis and tendonitis patients. There's a lot of subtlety to how to think about inflammation. And if you think about it correctly, analyze it correctly, you can get on the right path to getting the right kind of treatment regimen to actually treat the cause and problem of that inflammation, which is then going to improve your pain, your function, and your overall outcome long term. Until next time, hope everyone stays healthy and safe. As a reminder, we do this 2 times per week, Mondays and Wednesdays, a little different flavor on each day. But thank you for your time and have a good day and live well. Bye-bye.